Hello, welcome to the Pharmacology section of the topic General Pharmacology Part 1. Starting with the first MCQ, the question says the true statement about phase 2 clinical trials is. So, they are asking about the phase 2 clinical trials. The options are large number of healthy volunteers are studied. Second option, phase 2 clinical trial is used to determine maximum tolerated dose. Third option, it is used to determine efficacy. And the fourth option says it is used to determine toxicity. So the solution for phase 2 clinical trial is option number C. That is, phase 2 clinical trial is used to determine the efficacy. Now, for the solution, you should know that phase 1 majorly it is human pharmacology and safety studies, and it is used to determine the safety of the drug, and it is conducted upon 20 to 80 individuals. The phase 2, which is also called as therapeutic exploration and dose ranging phase, it is used to determine efficacy and the side effects, and it is conducted upon 100 to 500 patients. Phase 3 clinical trial is for the therapeutic confirmation of the drug, and it is used to determine safety, efficacy and adverse effects on a large number of population, which involves 500 to 3000 patients. But the phase 4, it is all related to the post-marketing studies. Next question, which of the following is not an example of phase 1 reaction in drug metabolism? So they are asking not. Focus on the word not over here. The options include acetylation, oxidation, reduction and hydrolysis. So the solution here is option A, that is acetylation. So acetylation is not a phase 1 reaction. However, for phase 1 reactions, you need to remember it includes oxidation, hydrolysis, reduction, decyclization as well as cyclization. And the examples of reaction for phase 2 include acetylation, glucuronidation, sulfate conjugation, glycine conjugation and methylation. Next question says that the drug that is not metabolized in liver is. Options include penicillin G, next phenytoin, then erythromycin or cimetidine. So the solution for it is option A, that is penicillin G. So penicillin G is a drug that is acid. So yes, phenytoin is metabolized in liver. The next option, that is erythromycin, the liver metabolizes most of the erythromycin. That is also metabolized in liver into a structure called as cimetidine sulfoxide, hydroxycimetidine and guanyl urea cimetidine. So all these three drugs are metabolized in the liver. but penicillin G, it is not metabolized in liver. Next question, alkalinity of urine is done during. The options include barbiturate poisoning, lithium toxicity, alprazolam overdose, or diazepam toxicity. So they are asking, when does the pH of urine turns alkaline? So the solution to that question is option A, that is barbiturate poisoning. So barbiturate poisoning, it occurs due to the excessive dose of barbiturates. These are the substituted derivatives of barbituric acid, and the alkalinization of urine will increase its ionization and excretion, and it will terminate its action. Next question, who is known as the father of pharmacology? The options include Oswald, Langley, Rudolph, or Paul Ehrlich. So the solution is option C, that is Rudolph Buchem. So Rudolph Buchem and his well-known student and chemist, that is Oswald, these are considered to be the founders of modern pharmacology, but only Buchem is described as the father of pharmacology. And the option D, that is Paul Ehrlich, you should know that he is recognized as the father of modern chemotherapy. Next question, the fastest acting receptor is. So they are asking the fastest one. The options include G protein coupled receptor, ionotropic, enzymatic, or the nuclear one. So the solution is option B. That is, the fastest acting receptor is the ion channel receptor, which is also called as ligand gated ion channels. That is the ionotropic receptor, and their action is seen in milliseconds. Next question, when two different chemical acts on two different receptors, emphasize on the word different. So when two different chemicals acts on two different receptors and their responses is opposite to each other on the same cell, it is called as physiological antagonism or chemical antagonism, reversible antagonist or competitive antagonism. So the solution to this question is option A, that is physiological antagonism, and it is also called as functional antagonism. They have opposite effects on the same physiological function. The two drugs act on different receptors or by different mechanism but have opposite effect on the same physiological function, that is pharmacological effects rahega but in opposite direction. First example for this type of antagonism is histamine and adrenaline. Their effect on bronchial muscles and blood pressure is opposite. Then we have hydrochlorothiazide and triamterene on the urinary potassium excretion. Then we also have glucagon and insulin on the blood sugar level. So glucagon will increase the sugar in our blood whereas insulin will decrease. So that is how the effect is opposite. Next question, not true about teratogenicity of drug. Not true means they are asking the false statement. The options include it is genetically predetermined, next environmental influence, related to the dose of the teratogenic drug, or effects specifically at a particular phase of development of fetus. So the solution here is option A, that it is genetically predetermined. And for the definition of teratogenicity, we should know that it is the ability of a drug to cause abnormalities in the fetus when it is administered to pregnant women and it is not genetically predetermined. Next question. There are some undesirable but unavoidable pharmacodynamic effects of drugs which are known as. So the given statement is the definition of which of the following, that is toxic effects, side effects, idiosyncrasy or intolerance. The solution is option B. That is side effects. So in order to know all the four options, let's look at their definition one by one. So side effects is defined as any unwanted but unavoidable pharmacodynamic effect which occurs at the therapeutic dose. Side effects is not serious and it can be predicted from the pharmacological profile of a drug. The reduction in dose usually ameliorates the symptoms in case of side effects. The example of a side effect is glyceryl trinitrate, which is given during angina. It relieves the angina pectoris by dilating the peripheral vasculature, but it is also responsible for postural hypotension and throbbing headache. So these are the side effects of using glyceryl trinitrate, which are unwanted but unavoidable effects. Next we have the definition for idiosyncrasy. So idiosyncrasy is genetically determined abnormal reactivity to a chemical. Here the drug interacts with some unique feature of the individual which is not found in the majority of subjects or patients, and it produces the uncharacterized reaction. So that is idiosyncrasy. Example for idiosyncrasy is barbiturates. They cause excitement and mental confusion in some individuals. We also have quinine or quinidine, which cause cramps, diarrhea, asthma, and vascular collapse in some patients. So these are the idiosyncratic behavior seen in case of barbiturates and quinine quinidine administration. Then we have the toxic effects. The definition for it goes as these are the result of excessive pharmacological action of the drug due to overdosage or prolonged use. So remember the difference between side effects and toxic effects. Side effects, it was seen in the therapeutic window of the drug, but here toxic effect is seen during the overdosage or prolonged use of the drug. So overdosage may be absolute or relative, and the manifestations are predictable and dose related. The example of toxic effect can be given as morphine, which is an analgesic. It causes respiratory failure in overdosage. And we have imipramine, which is an antidepressant. Its overdose would cause cardiac arrhythmia. Okay. Then we have intolerance. Intolerance ka definition is the appearance of characteristic toxic effects of a drug in an individual at therapeutic doses. Here we get to see characteristic toxic effect, and it is the converse of tolerance and indicates low threshold of the individual to the action of a drug. The example of intolerance is only few doses of carbamazepine may cause ataxia in some people. One tablet of chloroquine may cause vomiting and abdominal pain in an occasional patient. Okay, so these were the four different definitions for toxic effects, intolerance, side effects, and idiosyncrasy. Next, the stimulation of liver microsomal enzymes can. Here they are saying stimulation. We have two things for the microsomal enzyme. One is stimulation, the other one is inhibition. So for stimulation, let's look at the options. They require the dose decrease of some drugs. Next, prolong the duration of action of the drug. Then intensify the unwanted reaction of drug, or require the dose increase of some drugs. So the solution for stimulation of liver microsomal enzymes is that on stimulation, the dose of the drug needs to be increased. So the correct option is option D. So remember, the liver microsomal enzymes are responsible for the drug metabolism, and its stimulation will decrease the concentration of drug in the body. Remember, if मेरा enzyme का amount will increase, so it will decrease the concentration of drug in the body, and because of that the dose of drug administered has to be increased. Then also remember, the microsomal enzymes are present on the smooth endoplasmic reticulum, primarily in the liver, kidney, intestinal mucosa, and lungs. The examples of microsomal enzymes are the monooxygenases, cytochrome P450, UGTs, epoxide hydrolases, etc. Next question, which of the following statements regarding the transfer of drug across placenta is false? So, which of these is the false statement? The options include maximum transfer across placenta occurs during the first trimester. Then, heparin and insulin can cross placenta. Iron trapping of basic drugs occurs in placenta, or the P glycoprotein is present in placenta. So, which of these four statements, which one of these is a false one? So, remember the correct answer here is option B, that is, heparin and insulin cannot cross the placenta and is therefore considered as safe during pregnancy. Next, a 70 kg man is given a drug with a dose of 100 milligrams per kg of the body density with its half-life of 10 hours and plasma concentration of 1.9 milligrams per ml. So the clearance of the drug is, four options are given here, that is 0.2, 0.5, 2 or 20 liters per hour. For solving such type of problems, you all need to know the formula for clearance, that is 0.693 into dose divided by the plasma concentration into T half. So as they have given a 70 kilogram man and the dose is 100 milligrams per kg with the body density, the total dose turns out to be 100 into 70, that is 7000 milligrams. So as you all substitute the values for dose as 7000, plasma concentration as 1.9 milligram per ml into the T half, that is 10 hours. If you calculate, the value turns out to be 255 milliliters per hour, and that turns out to be 0.255 liters per hour. Hence, the correct option here is option number A. Next question, which of the following antiplatelet is a prodrug? Okay, the options include aspirin, dipyridamole, ticlopidin and apixaban. So the correct option here is option number C, that is ticlopidin. So ticlopidin is a prodrug and it gets metabolized into its active form, that is thienopyridine, and it requires activation in the liver by cytochrome P450. Hence, only ticlopidin is a prodrug while others are not the prodrugs and do not need activation. Next question, G protein coupled receptors span the plasma membrane as a bundle of how many alpha helices? The options include 4, 5, 2 or 7. So here you can see the solution is option D, that is 7. So G protein coupled receptors are a large family of cell membrane receptors which are linked to the effector enzyme, channel or carrier protein through one or more GTP activated proteins for the responses. So remember, the G protein coupled receptors, they have 7 alpha helical membrane. Okay. Then they have hydrophobic amino acid segments. So these are the 7 alpha helices, as you can see the numbers 1, 2, 3, 4, 5, 6 and 7. The agonist binding site is located between the helices on the extracellular surface, that is this red portion, and the G proteins float in the membrane with their exposed domain lying in the cytosol and are heterotrimeric in composition. That means they have the alpha, beta and gamma subunits. So उनका extracellular portion is here, जहाँ पर we will find the NH2 terminal, that is the N terminal, but intracellular portion पर we will find the C terminal. Then here we have the disulfide bridge, then here agonist binding site and the 7 alpha helices. Next question. All of the following are features of inverse agonist except. So for this you all need to know what is an inverse agonist. The options include: it is easier to observe inverse agonism if there is sufficient constitutive activity of the receptor in the absence of agonist. Next, an inverse agonist has higher affinity for the active form of the receptor as compared to the inactive form. Then we have, if the equilibrium of receptor state lies in the direction of inactive conformation in the absence of ligand, it may be impossible to demonstrate inverse agonism. And then famotidine and losartan are the examples of inverse agonists. So remember, here the solution is option B, that is the inverse agonist has more affinity on inactive form of drugs as compared to the active form of drug. So option में ये उल्टा दिया हुआ है, and they have affinity but negative intrinsic activity. So remember the features for inverse agonist. All other options are correct except the second option, that is inverse agonist has more affinity on the inactive form of drug than the active form of drug. Next question. All of the following are true about competitive inhibition except. So we need to find out the false statement for competitive inhibition. The first option is it resembles chemically with agonist. Next, bind the same receptor. Next, reduces potency. And next, the maximum level is not reached by increasing the concentration of the drug. So amongst the four, the correct answer, which is that is the false statement for competitive inhibition, is option D. That is, in competitive inhibition, maximum level of drug can be reached by increasing the concentration of the drug. Okay, and they have given that the maximum level is not reached by increasing the concentration of the drug. However, the maximum level is or can be reached by increasing the concentration of drug. Next, which of the following is the correct description for phase 2 metabolism? So, let's see the true statement for phase 2 metabolism. Options include the reactions which add a polar molecule to functional group already present on drug or its metabolite. Next, reactions which add a polar functional group only to the drug. Next, reactions which occur in gut wall and the reactions which occur in intestine. So among the four statements regarding phase 2 metabolism, the first statement is the true one, hence the solution here is option A. The phase 2 reaction is conjugation reaction and it adds the polar group to functional group already present on the drug or its metabolite. तो remember जो हमारा phase 2 reaction है वो हमारे drug के metabolism में either on the drug or on its metabolite, it will add a hydrophilic portion in order to make it water soluble and can be easily excreted from our body. So it will add up the functional groups not only to the drug but also to the metabolite. Next, which of the following is a wrong match about teratogenic effects of drug? So we have zidovudin for skull defects, thalidomide for limb defects, phenytoin for facial defects, and tetracycline for teeth abnormalities. So remember, zidovudin is not a teratogenic drug and it can be given to the pregnant women. Hence, the first match that is given for zidovudin and skull defects, that is the wrong match. However, we know that thalidomide will cause the limb defects, phenytoin causes facial defects, and the tetracyclines are responsible for the teeth and bone abnormalities. Hence, other three options are the true ones.
Next question. What is the clearance of a substance if its concentration in plasma is 6 milligrams, its concentration in urine is 100 milligrams, and the urine flow is 2 ml per minute? So these are the options for the given question. Let's see how we calculate such problems. So the formula for clearance is rate of elimination divided by plasma concentration. And we have one more formula for clearance that says concentration and in urine multiplied by urine flow divided by plasma concentration. So as the rate of elimination is equal to concentration of urine into urine flow, the clearance can be calculated with the given numbers and we get 33.33 ml per minute. Hence the correct answer is option D.
Next, which of the following drugs have a narrow therapeutic index? The options include lithium, diazepam, penicillin, and diazepam. So, the solution for a narrow therapeutic index is lithium. The correct option is option A. Now, what is a therapeutic index? So, the therapeutic index is the range of doses at which a medication is effective without unacceptable adverse events. Okay. So there won't be any adverse events seen in the range of therapeutic index. So the drugs with a narrow therapeutic index have a narrow window between their effective doses and those at which they produce adverse toxic effects. Also, for the definition of therapeutic index, it is the ratio of lethal dose to the effective dose which is used in assessing the safety of a drug. Then lithium is a drug which has a narrow therapeutic index. The examples of drugs which have narrow therapeutic index are digoxin, warfarin, valproic acid and gentamicin. Next question, the metabolite of spironolactone is? The options include aldosterone, canrenone, corticosterone and pregnenolone. When they ask the metabolite, it directly implies that spironolactone is a prodrug. So, the solution for metabolite of spironolactone is option B, that is canrenone. So, metabolite is the canrenone and spironolactone, which is a prodrug, gets converted into canrenone. Next question, CYP450 is inhibited by. The options include phenobarbital, cimetidine, phenytoin, or CCl4, that is carbon tetrachloride. The correct answer here is option B, that is cimetidine. So cimetidine is a cytochrome P450 inhibitor and it decreases the metabolism of other drug which is given in combination with cimetidine. Now what do we understand by it decreases the metabolism of other drug? It means that since cimetidine is a cytochrome P450 inhibitor, हमारा जो cytochrome P450 है वो नहीं बनेगा and if our enzyme is not there, it will decrease the metabolism of other drug which would be given in combination with the cimetidine. Next question, idiosyncratic reaction of drug is. So, the options include a type of hypersensitivity reaction, a type of drug antagonism, unpredictable inherent qualitatively abnormal reaction to a drug, or a quantitatively exaggerated response. So, the correct option here is option C, that is unpredictable, inherent, qualitatively abnormal reaction to a drug. So, you should know that the definition for idiosyncrasy is given as it is genetically determined abnormal reactivity to a chemical. Remember the term abnormal and genetically determined. So, in idiosyncrasy, the drug interacts with some unique feature of the individual which is not found in majority of the subjects and it produces the uncharacteristic reaction. As such, the type of reaction is restricted to individuals with a particular genotype. Okay. In addition, a certain bizarre drug effect due to the peculiarities of an individual are included among the idiosyncratic reactions. The example we have for an idiosyncratic behavior of a drug is barbiturates, which causes excitement and mental confusion in some individuals. Next question, a patient with an edema would have increased volume of distribution if. So the options are the patient was taking an anionic drug, the patients were taking a hydrophobic drug, the patient was taking a hydrophilic drug, or an edema always causes an increase in volume of distribution. So the correct option over here is option C, that is if the patient was taking a hydrophilic drug. Now remember, अगर हमारा drug hydrophilic है, it means it is lipophobic. If it is lipophobic, it will not distribute into the adipose tissue and it will have higher water solubility. Now, अगर वहाँ पर edema हुआ, that is due to the onset of edema, there would be increase in the plasma fluid into the interstitial spaces. उसके बाद क्या होगा? This hydrophilic drug can then distribute in that fluid due to its solubility in plasma fluid. Hence, अगर in edema हुआ patient को, so उसका volume of distribution will increase if the patient was taking a hydrophilic drug rather than a anionic or hydrophobic or some other drug. Next question, which of the following is not associated with GPCRs? The options include adrenergic receptors, GABA B, muscarinic cholinergics, or nicotinic cholinergic receptors. So, the solution for this question is nicotinic cholinergic receptors. So, the nicotinic cholinergic receptors are the ion channel receptors and they are not associated with the GPCRs. Thank you so much.